just want to introduce ourselves. So Katie Karski and I are two of the new leadership members of the Cursive leadership team. So we are incoming fellows, or I guess you're fellows now, active fellows currently in colorectal surgery. And we're excited to be here moderating today. Feel free to put any questions that you might have for the audience into the live stream chat. We're monitoring it, and then we'll ask those questions as well. So as a quick introduction, my name is Ivy. I completed my general surgery residency at UCLA, and I am doing my colorectal fellowship at UPenn.
And I'm Katie Karski. I did residency at Lenox Hill Hospital in Manhattan, and now I'm at Cleveland Clinic, Florida. So I think we're going to go through and introduce each of the panelists.
Yes, so we'll just do a quick introduction, and the panelists can feel free to introduce themselves in more detail. So first, I wanted to introduce Dr. Megan Derbyshire, and she just completed her fellowship at Allegheny Health. Our next panelist is Dr. Fumiko Egawa, and she completed her fellowship at Brown University. And finally, we have Dr. Tak Patel, who completed her fellowship at the University of Miami. Sorry, had a little brain fart.
University of Southern California.
Oh, I am so sorry. I don't know. I really had a brain fart there. Okay, perfect. So while we're waiting for additional questions to pop up, Katie and I actually have some questions for you guys. Maybe we can just start with a general question. So any general tips for having a successful fellowship year, things that you maybe wish you had done differently if you had known earlier?
I think just remember that it's only a year. So don't lose out on any experiences because you only get this like 12-month period and then it's over. So I think like I kept an eye on the case logs all year. But like the last day, it was like, oh, I really wanted to see an anorectal advancement flap, and I didn't get to see one all year. So like I stuck around for the 31st just to see that one case. Yes, I have.
Yeah, I think piggybacking off of that, talking with my co-fellow, I was in one of those programs with two fellows. It's not residency. Take advantage of going after those cases and those experiences that you may not have gotten or may want to have more exposure to. It is, like Megan said, just 1 year. And so we really honed in, not just necessarily for a case log, but for something that we felt was valuable for education on what we wanted to do. And then I think the other was, meeting with faculty early on and asking for what their expectations are as you go through the year. There is graduated responsibility, at least where I did my fellowship. And they were very, very good about checking in and updating what their expectations were as the year went on, and to make sure that I wasn't missing the mark, and to make sure that I was successful.
I think also just because it's 1 year, really trying to understand the nuances. Sometimes, at the beginning of the year, especially, I would see attendings choose different pathways for different patients with similar presentations, and I would just kind of accept it as attending preference. And then as I started to learn a little bit more, I started to inquire more about the reasoning, and that gave me a lot more insight. So trying to don't leave any stone unturned.
I think all of our faculty were really excited when we would ask, so why did you do this? Why not do this? Like the textbook says to do X, Y, or Z, and we're doing P, Q, and R. So what am I missing for the nuance? And they were really excited to talk through it. And I hope that's everybody else's experience, to have somebody who's willing to talk through it and really form those relationships.
So we're brand new fellows. So, we come in day one and there's a million different things to think about. What strategies or tools did you guys have as far as staying organized with deadlines, preparing for cases, reading, studying, boards prep? What were your priorities at the beginning of the year, and how did you kind of best organize all that?
I think you have to figure out what type of program you're in. So my program really didn't care if you met the ASCRS deadline for abstracts. But if that's something that really, like, we were required to go contractually to the conference, so whether you presented was irrelevant. But like if that's something that you are expected to do, then have an idea and hit the ground running and get that off ground. Video case reports, super easy to do, a lot easier than getting an IRB off the ground for a poster. and I got to present a podium on a video. So just, know the deadlines, like look them up now. When's stages, when's ASCARs, when's ACS, like what can you make? And then for us, like there was me and a co-fellow, and we had to present every other week. So that kind of kept us on track for studying, because you had to read the chapter because you're making a whole PowerPoint on it. Yeah.
I think making sure you have a schedule. So my co-fellow and I would, again, every other week we were making slides and presentations. We had a couple of other regional conferences that we would present at least on Zoom or Teams at one point, and making sure we were just on task every week, and just creating a schedule with that. In terms of cases, we had a very strong residency program associated with our fellowship. So we would talk with our chief residents, what cases do you guys still need? What cases do we want to cover? And come up with a weekly schedule and read ahead about our patients, look at the scans and everything else the weekend before. And so that was a really nice way of prepping for each week. Again, that was very specific to this program. Yeah, and then just knowing your deadlines. Our program was very insistent that we have each a project to submit to ASCARs and to present, but we also had other regional conferences that we were required to submit to and present at. And so making sure you carve out admin time, whether that's designated by your program or talking with your faculty, like, hey, I'm going to clinic for a day. I will be in clinic until 1 p.m. And then from 1 p.m. until 5, I will be doing admin time working on research projects and being pretty upfront. Our faculty were very receptive to that.
I think similar, mine was kind of more tailored to my program. We had to make some tumor boards here and there. We had presentations every now and then to give and make a schedule. So I kind of tried to dedicate a different day of the week to those tasks. So there would be like a specific day I would try to work on tumor board or the schedule or something. But what helped was making the weekly schedule for case assignments between you and the resident a week out. That way both of you could know what to expect for that week and which days you'd be busy, which days you'd have more free time to work on the other stuff you have to get done.
Great, thanks. Speaking of, a lot of you mentioned having a co-fellow or someone else at your program. Were any of you at single fellow programs? And if so, how did you make connections with fellows at other programs? Or if you were at a program with very few fellows?
So my co-fellow and I were in separate cities. So I sort of relied more on connections from residency. And then I had also done non-accredited year before my accredited year. So I kept in touch with my co-fellows from, I did the unaccredited year at Orlando, Advent Health in Orlando. So I used them. But at my year, there was also a single fellow WhatsApp group. So you can initiate that on your own and just have everyone just join in the WhatsApp and you can commiserate together being single fellows. And then the PAs were a great resource too, just getting to have new friends in the city, getting to know the PAs at my hospital.
So I only had a co-fellow, but mine was at the same city and frequently we were at the same hospital, so slightly different. He and I both, obviously it's too late now, but when we were going through our ranking and match process, both valued having at least one co-fellow. The New England fellows are pretty close. We have our own separate New England fellow thread for our cohort. And then we sort of adopted the single fellows who were in that thread as well, just sort of making sure that they didn't feel left out in the cold.
I also had a co-fellow, so I might not be the best resource for this question, but I think like conferences, we had a Southern California ASCRS chapter and other fellows from other institutions would come to that. So that was a great way to meet other people in a similar space as you.
Sweet.
Another question we had was job search timeline, and how to best go about job searching. How do you hear about what opportunities are available? How do you know what books are out there? When do you talk to a recruiter, potential employer, things like that?
I think it's great that the society puts on a career course. It is sort of like a pep talk that you get right before you take your oral boards if you're a November oral boards person. And they kind of give you some ideas of like how to manage an interview and everything else. But my strategy was I wanted to take and pass my oral boards before starting the job search. I had tried earlier in the year and was told by future employers, like, you should probably have more than a week under your belt before we will consider you. And you're like, okay, fair enough. And just be pretty aggressive, be aggressive when following up with the recruiters, because it is in their benefit to have people continually following up with them, but not telling you necessarily, they won't provide an update. Oh, we filled the position until you follow up. So that was something to learn. And then being very clear about what you want to do for your first job and understanding that you may not get your dream job. And that's okay. I am taking a job that I didn't necessarily have like on my mind when I was starting my whole job search, but I'm not overly upset about it. But also don't freak out if you haven't signed something and it's pretty late in the year, because my co-fellow and I and some of our faculty and some of the other New England faculty all signed their contracts basically in June when they all started their first job. So not great, but also not the end of the world.
I think, oh, sorry, Megan, go
No,
ahead.
go for it.
I think most people started looking around November was about on the earlier end of it. That's right after the career course you guys go to. It kind of lights a fire under you and puts some urgency to the job search. You should touch base with your program director and your attendings very early on, especially if you have a geographic preference or a job type preference, like if you want to be academic or not academic. Just let them know what your goals are in terms of the job, and they'll look out for any postings that they've heard of that match what you're looking for, and they'll be really great about forwarding those things. Apart from that, you just kind of look on job boards. All the societies have job boards, general job boards. They're posted kind of all over online. And a good piece of advice we heard was sometimes the jobs, when they're posted, there's already someone in mind. So don't take it personally if you apply and you don't hear back, or they tell you that the position's already filled and you're like, how's that possible? They just posted last week. So it's kind of a long process, and you start it pretty early in November.
Yeah, same. I didn't start looking until after the career course. I would say that the job boards maybe, I think, feel like they only post maybe 30% of the jobs that are actually out there. A lot of stuff is word of mouth and connections. So the more connections you have, just use everyone. I found the job I have through a bariatric surgeon I went to residency with after seeing them at Sages. So Sages in March, so I didn't have like a job lined up until pretty late. But I think you just have to, figure out something about it, whether it's a where you want or what kind of style of job you want, and then just go from there. And that was the biggest thing that the career course helped me figure out. Once you have an area in mind, then you can start like emailing recruiters at hospitals. I didn't find recruiters in general to be helpful because they're just sending you all the stuff that's on the job boards. Um, and they're not always specific to what you want. Like, I don't know how many job offers I got for general surgery jobs when I'm just like, nope, strict colorectal. But then once I actually knew, like, okay, I want to be in this area, I started emailing hospital recruiters specifically, and that was a lot more effective.
And to Megan's point, use everybody. My co-fellow, his partner was very specific that they had to either be in New York or New Jersey, which is a very saturated job market, and for family reasons. And so he started reaching out to every hospital recruiter possible, and sort of got no traction. But our Da Vinci rep actually got him a couple of interviews, and 2 offers popped up from those interviews as well. So using everybody, or using even people in your cohort, people that you went to residency with. Like some of the things that were sent to me were people in my own cohort who are like, hey, I'm not really interested in this area, but I know you're flexible or you have ties to this region. I figured I'd pass this along. It sounds really great.
Yeah, use the WhatsApp. There's a lot of quid pro quo. So you heard about a job, but you're not interested, give someone else a shot at it. You'd be surprised what pops up there too.
Awesome. That's great. You also mentioned the timing of oral boards with the job search. Do you feel like there's any benefit to doing the spring versus the fall?
So I took my oral boards in that first week that you could in November. I know some of my friends who took it in March were saying that they just went really hard on the job search from basically career course until about January, early February, and then stopped to focus on studying for boards. And for them, a lot of it paid off. They got the academic jobs that they wanted because they were all being posted at that time and they were focused on that. But I think it was really nice to also just get the oral boards out of the way. To that point, once you get your Gen Surg written boards results, those November dates go really fast if you're really looking for a November date. Our faculty were like, hey, we know board results are coming out. You should probably both go to clinic. That way you can see when the email comes in and sign up for the date that you want. Otherwise, some people are in the OR and they get a later date.
I think it's probably just best to take it while it's fresh in your mind too, rather than when you're 100% colorectal.
I took them in March, just because that's what worked out for my schedule, and I had more people to study with in March, and I think it was fine. I definitely had more time in my schedule at that time, so look at your schedule for the year, whatever works for you. I think it'll be fine either way.
Awesome. And it sounds like the career course was pretty helpful. Are there any other courses that you feel like were must-dos?
I actually really like the endoscopy course. In my fellowship, we did a lot of screening colonoscopies and sort of just, or like surveillance and some polypectomy, some snares, but we didn't do a lot of the advanced like ESD and EMR. So it was really nice to get more exposure to that. And especially because I knew my program didn't have that.
I agree. I have to plug the endoscopy course since it was held at my institution. I think it's a great resource. They kind of scare you into the future of even more minimally invasive surgery. And it just kind of opens your eyes to everything that's available out there. I also really enjoyed the robotics course. It was good to hear from some of the experts how they optimize their port placement and how they do their procedures and just practicing those anastomoses in kind of calm environment. I practiced in hands-on end-to-end anastomosis for the first time there. We don't do them at my institution, so that was good to see a different technique.
I think I did the advanced version of the robotics course. So they did LAR and VMR instead of the intracorporeal anastomosis. So if you did a lot of robotics in residency or your program is super heavy robotics during fellowship, then you can look and see which date or ask your rep which is the advanced date and do that. But even that is a little you can get away without doing that if you feel really comfortable with the robotic platform. And then I didn't do the endo course because we do stenting and we do a lot of those advanced procedures. So you can pick and choose. I think staying on top of the group chats, like you might be able to figure out when the HRA course is. There's a HALS course that gets offered either by Leahy or one of the Florida programs. There's an SNS course for the InterStim that was offered in Minnesota. So just keep an eye out, especially if your program director is not great about answering emails. Like mine's like a month behind. So you have to like do a little bit of like advocating for yourself to figure out when the dates are for some stuff.
I think to that point, talking to a few other people in our cohort, different programs have different approaches for which courses and how many courses you can go to or how many conferences. A lot of these courses or conferences like the career course and stuff are funded. So it really is minimal cost to you, or you pay for the flights and you get reimbursed afterwards. So I think taking advantage of that, it's more, at least at Brown, it was like a manpower thing of not having a fellow, like having me out for 48 hours was a big deal. They didn't really care that it was whether or not they were like, well, we'll pay for it, but we just don't want you to be gone for 48 hours because then, it's your co-fellow, or we're relying on a chief resident who has already matched to breast and has no interest in doing anything anorectal for the 48 hours that you're gone for covering the service. So getting a feel for your program and what their tolerance is for having a fellow absent versus other programs, they're like, no, if you want to go, it's for your education, absolutely, we can run without you. Every program will say they can run without a fellow, but not every program runs very well without a fellow.
Awesome. We were also wondering, what was the hardest part of fellowship, or what were some challenges that you might have faced during fellowship? What ways did you use to manage those issues? Like if you had challenges with, I know it's like, don't want to put anyone on blast, but if you had issues with your co-fellow or something, or if you had issues with your program, or just trouble maybe acclimating to a new environment with new people, how did you meet those challenges?
I think the biggest challenge for me was, I thought I was taking ownership of my patients in residency, but fellowship's a whole new level of ownership and autonomy, and you feel the gravity of your decisions and the outcomes associated with your decisions. So sometimes if patients don't do well, you take it very personally and, it's a little harder. This might not apply to everyone, but I had a lovely co-fellow that I could commiserate with and talk through cases with, just making sure you have a strong support system, especially if you're an alone fellow. It can be challenging sometimes when you're doing the case and, it's your complication or when you made that decision and something happened.
Yeah, my co-fellow was an invaluable resource. He and I very early on decided to not keep score on how many of each other's complications we would end up taking back, when we were on call. But it was really nice to have that. I think also with faculty, my faculty were very receptive to feedback, like, hey, I think this is going well, or hey, can we make this change to how the service line is run, or whatever it was. And they were very receptive, which was really great because some of it actually ended up making the rest of our fellowship a lot better when we made some changes. And then when we had some issues with a couple of difficult personalities, we had a few new APPs who didn't quite get the rest of the culture and were a little bit more forceful on how they felt their scope of practice applied to fellows and residents and medical students. Talking to our PD, he was really great about sort of intervening and smoothing things over and helping clarify, these are the roles and responsibilities of each person on the team. So just, finding at least one, hopefully more than one person in your faculty who you can talk to, whether it's about difficult cases or board prep or like, what am I doing wrong with my job search? Like seeking out that mentorship and that sponsorship.
Yeah, I think probably the complications. I feel like I saw more complications in fellowship than I did in residency, and I think that's just the volume of surgery. I mean, I had four surgeons in residency, but they didn't operate nearly as much as like one of the surgeons I worked with in fellowship. So try not to take it personally, and just try to learn from every complication.
Were there any resources, books, videos online that you felt like were the most helpful?
There's an ASCRS webinar series that I did find helpful preparing for some of the conferences. And then I had, I think at one point there was some like back and forth on WhatsApp of people sharing slides and PowerPoints, but no one was really tech savvy enough to figure out how to like find a common place to deposit slides so that we could just throw stuff back and forth. YouTube, Surgeon, both great resources for finding videos on things you haven't seen or done before. And DCR and ASCRS and SAGES are all working on their video repository as well. So there's a lot of good video resources outside of that. ASCRS U, the textbook has been pretty helpful.
We did a lot out of the ASCRS U like app / textbook. That was the basis for all of our didactics, but also when we were presenting M&Ms, they would have the colorectal fellows. We would present M&Ms like once a quarter, and we would just draw heavily from the textbook because at that point it wasn't so much the complication as like, let's learn the anatomy or let's learn the case, because it was geared towards general surgery residents and not, colorectal fellows.
Yeah, we also used ASCRS U mostly. What I liked about it is, particularly for like rectal cancer, it walks you through historical treatment and kind of gets you to where we are. So it gives you a little bit of a context that the attendings might have that we maybe didn't pick up in residency.
There's also the ASCRS clinical practice guidelines, which are pretty helpful. And I heard they're very helpful for board prep as well.
Sort of piggybacking off the original question, but were there any like electronic resource, like organizational tools that you use, like to keep notes or keep organized? Or was it kind of like pen and paper for y'all?
I'm a pen and paper girl. I tried early on in medical school to do like, get real cute with like OneNote or whatever, different types of things. And it went very poorly. So I stopped using a notebook. I have like free leaf paper and like drawings and notes and everything else. As well as I kept a hard copy of my case log with drawings of like port placement or like how did we do these sutures or how did I orient the staple drawn in next to that case. But my co-fellow, he did everything on his computer. I don't know what app he did, but he does everything electronically and has it uploaded to some cloud platform so he can pull it up on all 7 of his devices if he wanted to.
Yeah, I think now might not be the best time to change it up. You should kind of focus on falling back on whatever study method has worked for you in the past, and try to tailor the resources that you have to that study method instead of trying to tailor yourself to the resources. The only other thing I forgot to mention is AskOurs also has a question bank that's useful, especially just before you're in service.
It's a little bit like CSAP where you click it and then it gives pretty good cited sources for the explanation.
Wondering if any of you had a family or child, spouse, significant other, partner with you during fellowship, and if so, how did you manage to balance work and your life if that was a challenge? And it also doubles for if you had a partner who was in another city.
I did not. I don't know if any of the other fellows.
Just dogs for me, and Rover was the answer.
I did. I had a relatively busy year outside of work as well. I did a lot of travel. And I think what worked for me was just communicating days that I needed to be off or away early, making coverage plans, just making it as organized as possible ahead of time. And I worked with a lot of residents this year who had a lot of family, and they would just be clear about communicating when they need to leave, what their needs were, if there was childcare involved. And as long as you're organized and proactive, I don't think it's an issue at all.
So I was here on my own, but my co-fellow was engaged and then got married during our fellowship year. So there was a lot of wedding planning. And the joke with his husband was that I saw my co-fellow more than his husband did, but that I also saw my co-fellow's husband more than he did. Was he was working as a traveling nurse, so sometimes their hours or the shifts wouldn't line up. But just being in a text thread with the three of them as a little family chat. Hey, so and so's grandma's going to be in town. Are you okay if we just switch call for that night? Type of thing. It's like, yeah, absolutely not a big deal. So yeah, to Talk's point, just being really clear and upfront ahead of time, not last minute. Worked out pretty well.
And then hindsight's 2020. Anything you wish you knew sooner or something you would have done differently?
I went to both Sages and AskOurs, and I think just because they were on the West Coast and I was coming from the East Coast, from a city that didn't have direct flights, that kind of sucked. So I probably would have just done one conference this year, although I did make a job connection out of it, so I guess I can't regret that too much. But I think there wasn't any educational course that I didn't go to that I regret having missed. I think maybe I would have just given up the Da Vinci one, because I think our robot exposure was sufficient without it.
To Megan's point, I went to ACS and AskOurs, and again, I also am in a city that doesn't have a big airport, so it was a lot of connecting flights, and I don't regret flying back to California at any point during this past year, either for the endo course or ACS. I'm from California, so it was a really great chance to see family by extending by a day. But it is taxing because in some cases it was your one weekend off and you're spending it flying across the country, spending 6 hours at a conference, and then flying back across the country. I similarly can't complain because I was invited to write a book chapter when I went to ACS. So not the worst thing to come out of it.
I know when I was interviewing, a lot of programs were emphasizing clinic time and making sure you're staying on top of going to clinic, having clinic exposure, so that towards the end of the year, you're not kind of rushed and trying to catch up on how to work things up in the clinic. We were required to go to clinic every Monday, and I think that really did set me up for success in my attending career, because I feel equipped in how to work patients up in clinic, but maybe focusing on that.
We also have a pelvic floor physiology lab that happened once a month. And so I think I ignored it too much in the first half of the year. And then it felt a little bit like a scramble in the second half of the year to make sure I got in to do the EMGs and the balloon test and learning how to work the rectal ultrasound and do the 3D images. So I think if I could do it over again, I'd start a little bit early in the year just to learn a little bit more about the pelvic floor physiology, as well as, more time in clinic. I definitely spent more time in clinic If you have an ostomy clinic in the outpatient, I would say go to that for even just half a day. It sounds crazy. I went and I learned so many things from our outpatient ostomy nurse, like all these little tricks and tools and how to tell when something's not sealing, not when it's pouring out, but before it gets to that point, and how to troubleshoot that. And I wish I'd gone earlier in the year, because our outpatient ostomy nurses are incredible and they have so many little tricks and things to teach.
Yeah, I think if you're in a program where the experience isn't like heavily curated for you and you have to like figure out your own schedule and manage your own numbers and all that stuff, like just find the best way to advocate for yourself. I definitely did a lot of transrectal ultrasound, but that's like the attendings just weren't looking out, so you had to really look out.
And then I think similarly, don't forget anorectal. If you're in a super busy program with a lot of abdominal cases, just like clinic, anorectal may fall by the wayside unless you're made to do it. So try to carve out some time for that. Make sure you're comfortable before you go out into practice.
I would argue my co-fellow and I each tried to have at least one anorectal day a week. It's a really nice sort of relatively easy, but still somewhat challenging clinically. OR day, like after you've had like a couple of really big, long days, like a pouch excision and a pelvic extent, it's really refreshing to then just blow through like 6 hemorrhoidectomies and a fistula. Because you feel like you won and you're still learning the anatomy and you still found the fistula tract and you still feel like you've helped somebody, but you're also not there until 10 o'clock at night, hungry and dehydrated.
Thanks for that advice. We actually have a question in our live stream chat. We touched upon this already. So the question is, how did you approach your job search for post-fellowship networking, reaching out to practices and postings? And our panelists had mentioned that many of them got started after taking the oral boards in November, and reaching out to, if you are interested in a particular location, reaching out to recruiters specifically in the area. The second part of the question, which I don't think we touched upon yet, is how do you figure out what is a good fit for you after you've maybe made some connections?
It's tough. I had a vague idea of the type of practice I want to go to, and I had a strong geographic preference. I think Megan briefly touched on this, but also don't hesitate to cold email people if you have a geographic preference. I had a lot of responses just based on cold emailing people. Sometimes I was just guessing the email if I couldn't find it online. And people were pretty receptive to that, more than I thought they would be. And also don't be alarmed if no one responds. Anyways, sorry. It's tough to know exactly what you want. I think I interviewed at different enough locations where it became more apparent to me throughout the interview process. Like, I don't want to be super heavy in this one thing, or I don't want to be kind of catering to this one pathology alone. So that helped me. And then what was really reassuring was during the career course, hearing that your first job is not your last job for the vast majority of people. So you're not tied down, but you got to start somewhere. So
Yeah, I went in thinking I wanted to do something academic, like some sort of academic post, and was sort of, I guess, balancing the idea of doing some general surgery, since a lot of the academic positions at that time were saying you do 10% general surgery if you're like part of the like a faculty for a residency. And sort of coming to grips with, well, is that something that I'd be happy with or willing to live with for 3 to 5 years? And then sort of a lot of soul searching. It is tough. A lot of soul searching, like, what do I want my career to look like? So I'm going to a hospital employed job, as I realized what would be best for me personally and professionally in my development and my next phase, would be being able to do the case entirely by myself, and not having to share it with a resident or a fellow or a medical student or a PA. And I know that sounds selfish, but we've never been able to do cases on our own, really, truly. And so that was something I thought about. And then in terms of looking and interviewing at enough places, wanting to have at least one senior partner in colorectal available. And I will, and I'm really excited to work with my senior partner. He's excited to mentor. And so it seems like a really great fit, but making sure you meet the people you'll be working with.
Yeah, just go through and start making a list. Like, doesn't matter if you have partners, doesn't matter who those partners are. Like, from a seniority, are they general surgeons? Are you true colorectal? Like, does that matter to you? Does location matter? Do you want to teach? Do you care if you're working with PAs? Do you care if you're the only one taking calls at night? How often do you want to be taking those calls? Because then they'll figure out how big of a practice you want to be in. So think back to like every environment you've ever been in and see if you could picture yourself in that. And then you know what, at least where to start looking. And if you can't figure any of that out, then at least figure out a geographic location. Because like I went into the fellows course not knowing anything and was like, maybe I'll stay in the South. Maybe I'll go back to Northeast. Like I was like, anywhere on the East Coast would be fine. And that was way too broad. So try to like pick a state or two and go from there.
Then if you're not sure about regions, so I'm not really geographically tied. I talk to mentors and faculty and, from residency, as well as from my own fellowship, what were you looking for when you were looking at a job, or are you happy with what you have now? And some of my faculty from residency, they were required to take about 10% gen surg call as part of their practice and their contract. And one was deeply unhappy, and you could see as the years went by, the burnout becoming more and more real, while the other one was like, fine, whatever, this is no big deal. If I do this, I do this. If I don't, I don't, So figuring out what your threshold is, your personal threshold is for doing gen surg call. Because a lot of jobs will try to basically get you as a gen surg person on the cheap. Colorectal surgeons, we have higher RVUs and they'll go about the whole breakdown in the career course, but we are cash cows in that sense.
Did any of you have issues with like negotiation with your jobs, and like where do you kind of draw the line between trying to negotiate something and deciding that it's just like not going to be a good fit for you? I know it's like a very personal, like case by case question, but if any of you had those experiences.
That's where I found my program director to be helpful, because he was a guy who was not afraid to negotiate. And then having, I used Contract RX, and they were willing to, like, you can find someone who's willing to negotiate on behalf of you if you're not comfortable having those conversations. But that's like, I mean, you got to find the job first, and then like once you go through all that, they'll send you like an offer letter or cover letter or something like that. But like I mean, there's no harm in asking. I think more often it's just going to be like, okay, that region pays a lot less, and you just have to be okay with that or go to a different region.
I think the same as the worst they can say is no. I wouldn't necessarily, I guess I don't feel emboldened enough to ask for like outrageous things, but talking to some of my faculty who, it wasn't this, when I met them as faculty, that was not their first job. Like they've gone through this a few times. They have a lot more experience. I had a friend who's a contract lawyer actually look it over instead of using another service, because she's pretty protective of all of us. And she's like, whenever you get a contract, you got to send it to me, which was really helpful because there are things that she looked out for that I just was completely oblivious worth something to be concerned about. So I do think it's worthwhile having an extra set of eyes looking over your contract.
Agreed. Everything that the other two said. I think there's, why wouldn't you ask? They're expecting a negotiation. You have nothing to lose. That being said, I had like a lot of imposter syndrome when I was trying to negotiate. I was like, oh, I don't know. Like they're already paying me so much, but there's literally no harm in asking. And also I agree with having someone look over your contract. I used Resolve. They have the data that a lot of hospitals and institutions will use to determine your base salary. It's like compensation data from across the country, and they might share it with you, or that's what the lawyers will use to guide what your compensation rate should be. So that's very useful to have someone on your team that has access to what the hospitals are using as well. And then like the other said, they look at other stuff that you might pass over, like, distance for non-compete or block time or call coverage, if your call's paid, stuff like that. So it's very helpful to have someone who's an expert.
And they go over a lot of that stuff at the fellow course. That's where I got a lot of my questions and like the things that I asked for or didn't ask for. Even when I was like having a conversation with the contract lawyer, a lot of that stuff was stuff I picked up from the fellows course.
Agreed. A lot of things my friend brought up were covered in the fellows course, and then because of the nature of her job, a couple of things that weren't covered in the fellows course that she's like, you should probably ask for this because X, Y, and Z. I was told no, but again, I wouldn't have known if I didn't ask.
It's all super useful. Thanks, guys. anything that was a particular highlight or favorite part that you want to share?
I think my co-fellow was my favorite part. That sounds really silly, but I'm really glad to have had somebody to trauma bond with, if you will. But or to commiserate, or just sort of if there were really funny moments, somebody who knew the context. But then I think our cohort was fairly close, at least on the WhatsApp, and like when we went to ASCRS, people kept trying to meet up. So it felt like a more cohesive group. So it keep the people close. That was the real highlight.
Yeah, I agree. The people were the highlight. I had a lot of fun every time I got together with anyone locally or nationally. And even like from an attending level, it felt like you were being welcomed into this big happy family, which was very sweet to see.
100% agree.
Awesome. Well, it's 7:45 and our panel goes until 8 o'clock, but it seems like a good time to maybe start to wrap up. Any key takeaways, things that we didn't cover, things that you just really, really, really want to share to the new fellows about the experience and how to make the most out of this year?
I think we briefly touched on this at the very beginning, but it is just a year. So if you think an opportunity is going to come twice, it might not. So if there's something you haven't seen, make sure you go see it. If there's something you're not exactly clear on, make sure you ask it, make sure you make the most of your time there. But at the same time, you'll keep in touch with those attendings for the rest of your life. So it doesn't mean you only have a year to learn.
I think after after the fellows course for sure, and a lot of the other conferences, I found myself making a wish list of things I wanted to see or do during the fellow year. And I would circle back with my program director or one of the other senior surgeons and just be like, these are things I really want to see or do, like whether it was a robotic sugar baker or um, a different type of pouch. So just constantly revisit what you think you want out of this year, and find a way to make that happen.
And some of it can come just from reading, in the textbook. Like there's some maneuvers that they describe, and you're like, what is this? And one of our attendings is like, yeah, actually, you talked about this in conference 2 weeks ago, and we don't have enough reach, so we're gonna do it. This is here you go, girlfriend, let's go. But yeah, being pretty open and advocating for yourself about things that you want to see or learn or do with your faculty. The chances are they're not going to say no, they just don't have patience for that. But as long as they know, they'll keep an eye out for you. And then, we've had some where they'll say, hey, I know you're supposed to be in clinic this day because X, Y, and Z, but I actually added on a patient that you said you wanted to do this like endorectal advancement flap. Any chance you can make it, like, this will be great for you. So they'll look out for you, but you gotta advocate for yourself.
Great. Well, thank you all so much for joining our panel and for sharing your like sage wisdom that you've gathered over the past year. We really appreciate the time you took out of your now maybe not so busy schedule, now that you've graduated, to share these thoughts with us. Thanks.